this module, I will talk about opioids, how they can be used in treating chronic pain, as well as their side effects, risks, and complications. Opioids, also called narcotics, are carefully controlled substances that can be used for pain management. These medications come with some special concerns, so your healthcare team will be extra careful to make sure the appropriate medications are prescribed for your pain to keep you as safe as possible while making sure you get the pain relief you need. Different opioids work faster or slower. The ones that work faster tend to not last as long, and the ones that work slower tend to last longer. Many patients take a combination of opioids, one for lasting pain relief and one for occasional severe pain that isn't taken care of by the long-acting opioids, called breakthrough pain. Some of the short-acting opioids have acetaminophen in them for added pain relief, so be careful not to take more than the recommended amount of acetaminophen per day when taking these combination medications. As I mentioned, opioids have some safety concerns, so your provider will try other medications first to try to manage your pain as safely as possible. If you need to take opioids, your provider will carefully consider the risks and set goals to make sure your pain is well managed. You will also be asked to enter into an agreement with the VA stating that you will use the medication as directed in order to safely manage your pain. Opioid medications can help a lot with managing severe pain, but there are many side effects that can be unpleasant and maybe even dangerous. It's important to know what to watch for and to help keep you safe when taking an opioid medication. One of the most common side effects of opioids is drowsiness. These medications can cause you to have slower thinking and slower reflexes. Always make sure to assess your alertness before you drive or operate machinery. Find someone who can drive in place of you if you feel sleepy or confused. If your job requires operating machinery or driving, talk with your doctor about other pain management options first. You may develop constipation while taking opioids, especially if you take them over a long period of time. Your provider may recommend a stool softener or laxative to help relieve this side effect. Some things you can do at home to prevent constipation include taking a fiber supplement, staying well hydrated, and getting regular exercise every day. Occasionally, patients will experience itching while taking opioids. Your provider may need to change which medication you take, or they may prescribe medications to manage the itching. Sweating can be a symptom of withdrawal, but it can also be a medication side effect. If you experience this, try wearing lightweight clothes and staying well hydrated. Some patients experience nausea and vomiting, which often go away after taking an opioid for a longer period of time. Talk with your provider if you have nausea that causes frequent vomiting or does not improve after a few weeks. Opioids may also decrease sex hormones, which can cause other symptoms such as depression, hot flashes, and night sweats. Opioids can also affect regulation of menstrual periods, and patients who are pregnant or plan to become pregnant should talk with their doctor before taking opioids. Opioids may harm your baby if you take them while pregnant. Make sure to use effective birth control to avoid pregnancy while taking opioids. Opioids may also cause patients to develop brittle bones or cause increased risk of fractures. Taking opioids over a long period of time may increase your risk of getting infections more easily than normal. Patients with reduced lung function, diagnosed with sleep apnea, or other breathing problems may be at higher risk of having pauses in breathing during sleep, or having difficulty breathing even at doses of opioids that are considered otherwise safe. Talk with your doctor about any breathing problems you have. They may be able to prescribe treatments to help you breathe well while you sleep, or they may be able to find other effective pain treatments that don't require you to take an opioid. Sometimes patients experience even worse pain when taking an opioid, even though it should be relieving the pain. This is called hyperalgesia, and it can be caused by the medication itself. Talk to your doctor right away if this happens. The risks of taking opioid medications can be serious, so it's important to know what to watch for so you can use them safely. Here I will discuss the differences between tolerance, dependence, and addiction, as well as major drug interactions that can put patients at risk of an overdose, even when taking medications as prescribed. A patient that develops tolerance to opioids may need more medication to achieve the same level of pain relief than when they first started taking the medication, even if their pain is not getting worse over time. Tolerance can happen to anyone taking an opioid, and it can lead to needing larger amounts of medication over time. Physical dependence means that your body is used to having the medication. It is the reason that patients develop withdrawal, which is when you feel sick if you suddenly stop taking a medication. Addiction means craving a substance even when the substance is not needed for its intended purpose. In this case, opioids for pain. If you crave doses of your opioids, but you notice that you are not experiencing pain in between doses, talk to your doctor about how to reduce your medication. There are many substance overuse treatment programs to help patients manage addiction and cravings. Opioid withdrawal can be very uncomfortable, causing stomach cramps, nausea, muscle cramps, anxiety, increased heart rate, increased blood pressure, and sweating. Feeling withdrawal symptoms when stopping an opioid medication does not mean that you are addicted to it. If you no longer need to take an opioid medication, reducing the amount of medication you take over time before stopping completely can help you avoid withdrawal symptoms. Up to 25% of patients taking prescription opioids long-term struggle with addiction. Misuse of opioids leads to a high risk of overdose, which requires emergency medical attention. Opioid medications can cause death if taken too high a dose, with almost 100 Americans dying every single day from opioid overdose. Most often, opioid overdoses are accidental. Sometimes patients mistakenly take too much medication or receive medication from a source other than their prescription, which may contain other ingredients than the medication they are expecting to receive. Now that you've learned about the risks and side effects of opioids, let's talk about a few things you can do to stay safe while taking them. The VA has an opioid agreement with patients who take opioids. It helps describe what to expect, including risks and benefits, and it explains what you and your provider will do to ensure safe treatment with opioids. First, your doctor will start with a trial of opioids to make sure they are a good choice for your treatment. If you have bad side effects or are not able to take them as directed, your provider may stop the medication. Your provider will watch for behaviors that may indicate you are having difficulty managing the medication, including changes in your work or home life, missed appointments, lost prescriptions, or new legal problems. Your providers may order drug tests at any time. These may be to evaluate whether you are getting the right amount of medication, either too much or too little. These tests can check for drugs that are non-prescription, such as marijuana and cocaine, as these drugs may put you at risk of complications with opioids or may promote the risk of addiction and misuse. Next, there are some do's and don'ts to follow to be safe while taking opioids. Things you should do while you're taking opioids include taking all of your medications as prescribed. Make sure your medication list is up to date and provide an accurate list to all of your healthcare providers so they know what you take. Be careful operating machinery even after you have been taking the medication for a while, and anytime you change your dose or change to a new medication. Make sure your family knows you take opioids and have a naloxone kit on hand in case of an overdose. Make sure everyone in your house knows how to use naloxone if an overdose does happen. Naloxone is safe to use on all family members of any age and even safe to use on pets. If you drop a pill and your pet eats it accidentally, watch for signs of an overdose, administer naloxone if necessary, and then take your pet to the nearest veterinary office right away for further care and monitoring. In case of a human overdose, always call 911 because naloxone will likely wear off before the opioid does, putting the patient at risk of overdosing again. The don'ts of opioid use include not taking extra doses, avoiding drinking alcohol while taking opioids, not selling or giving your prescription opioids to someone else, and not buying opioids from non-prescription sources. Don't stop taking an opioid without medical supervision and advice, as this can lead to withdrawal, which can be very uncomfortable. Tolerance goes away after opioids are stopped, so make sure to start at a lower dose if restarting from an opioid-free break. Patients are offered naloxone free through the VA, even if your diagnosis is not service-connected. You will receive a kit with 2 nasal spray doses in it. It's important to keep them together because sometimes the first dose will not be enough to bring a patient out of an overdose, and a second dose may be needed. There are several signs of an overdose. The most common are a person who appears very sleepy, heavily nodding off, difficult to wake, or if they're vomiting. If the person has shallow breathing, is snoring, making gurgling noises, or choking sounds, these may all be signs that they're having difficulty breathing. Watch for bluish or grayish lips, fingernails, or skin, or clammy, sweaty skin. If you lift the eyelid, the person will also have very small, pinpoint pupils. There are many YouTube videos and other resources available to learn more about naloxone, how to store it, how to administer it, and what to watch for during an overdose event. In summary, opioids are not always the best choice for patients with chronic pain. There are many other medications available to help with pain management, as well as other lifestyle changes such as exercise, weight loss, and quitting smoking.